Welcome to the deep dive. Today, we're taking a close look at something really vital for our health that often flies under the radar: adult immunization.
Hmm.
We tend to think of vaccines as mostly for kids, right? But staying protected throughout our adult lives is just as crucial.
Absolutely.
We've gathered a range of information, guidelines, the situation in India, to really understand why this matters.
Exactly. And our goal with this deep dive is, well, to explore why adults need vaccines, what the current recommendations actually are.
And clear up some confusion.
Yes, clear up some of the common misconceptions. We want to equip you, the listener, with the knowledge to make informed choices about your own well-being.
And just to set the stage, consider this statistic. India still sees over 5 lakh, that's 500,000 cases of vaccine-preventable diseases every single year.
It's a staggering number.
And what's really significant is that vaccination could prevent over 95% of deaths from these illnesses. That really hits home, doesn't it?
It certainly does. It underlines the importance right away. So maybe let's start with a basic question people might have. Why can't adults just, rely on the vaccines they got as kids?
Yeah, that's a common thought, isn't it? Like, you get your childhood shots and you're set for life.
Right. But it doesn't quite work like that for everything. Think of it like this. The strong defense built by those childhood vaccines, it can gradually weaken over time for some diseaser.
Okay, so the protection can fade.
It can fade. Plus, as we age, our immune systems naturally become a bit less robust. They don't respond as strongly.
Making us more susceptible to infections.
Exactly. More vulnerable. And this is especially relevant here in India, given our aging population.
Ah, the demographic shift.
Yes. Projections show something like a 41% increase in the elderly population just in this decade. We're talking about potentially 194 million people over 60 by 2031.
Wow, 194 million, that's huge. A large group needing ongoing protection then.
Definitely.
So it's about fading immunity and aging immune systems. Are there other reasons why adult vaccination is necessary?
Oh, yes. Several other factors come into play. Your job, for instance. Some occupations have higher exposure risks.
Like healthcare workers.
Healthcare workers are a prime example. Also, travel. Going to different parts of the world can expose you to diseases that aren't common back home.
Travel vaccines, right.
Then there's something called post-exposure prophylaxis. That's when you get a vaccine after you might have been exposed to try and prevent the illness from developing.
Okay.
And crucially, getting vaccinated as an adult isn't just about protecting yourself. It protects vulnerable people around you. Think about vaccination during pregnancy to protect the newborn.
Right, protecting the baby.
And it contributes to community immunity or herd immunity. That helps stop outbreaks.
So lots of good reasons. It's interesting, though. India has this really well-established childhood immunization program, the UIP. But for adults, it seems different, less structured.
That's a very accurate observation. We have these detailed schedules for kids, but there isn't a single unified national schedule for adult vaccination in the same way.
So no official nationwide plan.
Not in that same standardized format.
Oh.
But, and this is important, guidance does exist. Major bodies like the ACIP and CDC in the U.S., the WHO globally,
Okay.
and expert panels right here in India, the Association of Physicians of India, the Indian Society of Nephrology, the Indian Chest Society, Geriatric Society,
Yeah.
they all provide recommendations for adults.
So the advice is out there, just maybe not as widely known or implemented systematically.
That seems to be the case. Awareness and uptake are definite challenges.
Before we dig into which vaccines, could we just quickly touch on what vaccines actually are? How do they work? Just a quick refresher.
Sure, absolutely.
Right.
Basically, vaccines are biological substances designed to stimulate your immune system.
Like a training exercise for the body.
Exactly like a training exercise.
Yeah.
Introduce a harmless version or just a piece like a protein of a germ, say a virus or a bacteria.
Yeah.
Your body learns to recognize it and build defenses, antibodies.
So if you encounter the real germ later...
Your immune system is ready.
Yeah.
It recognizes the enemy and fights it off quickly, preventing you from getting seriously ill.
And you mentioned different kinds of immunity, active versus passive.
Yes. Active immunity is what vaccines aim for. Your body actively creates its own long-lasting protection after getting the vaccine or after having the actual infection, though vaccines are much safer.
Okay. And passive.
Passive immunity is more temporary. It's when you receive antibodies from somewhere else, like a baby getting them from its mother through breast milk or through certain medical treatments. It provides immediate but short-term protection.
Got it. Vaccines active, long-term training.
Precisely.
Okay, so let's focus back on India. Who are the main groups currently targeted for adult immunization here?
Right now, the focus tends to be on well, specific age groups, particularly older adults and also
Okay.
individuals considered high risk.
High risk meaning?
People with weak immune systems may be due to illness like HIV or certain treatments.
Mm.
Individuals with chronic conditions like kidney disease, diabetes, heart problems, certain cancers,
Okay.
healthcare professionals, as we mentioned, organ transplant recipients, and of course, people needing specific travel vaccines.
What about the average, generally healthy adult? Are there vaccines recommended for sort of everyone?
Yes, definitely. Even if you're healthy, there are key vaccines to consider. Things like the pneumococcal vaccine, the annual influenza or flu shot, HPV vaccine, Tdap, which covers tetanus, diphtheria, and pertussis.
Pertussis, whooping cough, right?
That's the one. And of course, COVID-19 vaccines, also MMR, measles, mumps, rubella if you don't have immunity.
Okay, let's maybe break some of those down. Pneumococcal disease, you mentioned two types earlier, PPSV23 and PCV13. What's the story there?
Ah, yes, the pneumococcal vaccines. It's interesting because they work slightly differently. PPSV23, that's the pneumococcal polysaccharide vaccine, covers 23 types of the bacteria.
Okay.
PCV13, the pneumococcal conjugate vaccine, covers 13 types, but it generally creates a stronger, more robust, and potentially longer-lasting immune response. It's particularly good at generating immune memory.
Stronger response with PCV13. Why is that?
It's about how they stimulate the immune system. PCV13 uses a conjugate technology that engages more parts of the immune system, including T cells, leading to that stronger memory. PPSV23 mainly stimulates B cells.
I see. And PCV13 has also been shown to reduce carriage, right? Like people carrying the bacteria in their nose and throat.
That's a really important point. Yes, PCV13 can reduce nasopharyngeal carriage, which helps decrease the spread of the bacteria in the community. It has a broader public health impact. PPSV23 is still very effective, especially against invasive disease like bloodstream infections in older adults, but doesn't have that same effect on carriage.
So who gets which one? And when?
Generally, PPSV23 is recommended for all adults 65 and older, and for younger adults, say 1964, with certain chronic conditions.
Okay.
PCV13 might also be considered for adults, sometimes in discussion with the doctor, especially if they have conditions that severely weaken the immune system. Sometimes a sequence of both is used, often PCV13 first, followed by PPSV23 later.
Right. And availability in India. Cost.
Good question. PCV has actually been rolled into the Universal Immunization Program for children recently, which is great.
For kids. Okay.
Yes. And the Serum Institute of India launched a PCV in 2020. In the private market, PPSV23 costs around, say, 3,000 to 3,500 rupees. PCV13 is generally a bit less, maybe 1,800 to 2,000 rupees, usually just a single shot in the muscle.
Okay, that's helpful context. Now, influenza, the flu vaccine, that's an annual thing, right?
Yeah, it's absolutely annual.
Yeah.
The flu virus is tricky. It changes constantly, drifts and shifts. So the vaccine needs updating each year to match the strains expected to circulate.
And flu can be serious, not just a bad cold.
Definitely. Globally, the attack rate is estimated at 5–10% in adults each year, sometimes higher. In India, it's a major cause of respiratory illness. An annual shot is recommended for pretty much all adults.
What types are available here?
We have a few options. There are the inactivated vaccines, meaning they use killed virus particles. These come as trivalent, covering 3 strains, or quadrivalent, covering 4, given as a shot. There's also a live attenuated nasal spray vaccine, LAIV. You might know it as Nasavac. And now there's a quadrivalent version of the nasal spray too, Nasavac S4.
Nasal spray option. Interesting. Any reason someone shouldn't get the flu shot?
The main contraindication usually mentioned is a history of Guillain-Barré syndrome within 6 weeks of a previous flu vaccine. But generally, it's very safe and recommended.
All right. Let's talk HPV. Human papillomavirus. Often linked with cervical cancer, but it affects men too, doesn't it?
Absolutely. HPV can cause several types of cancer in both men and women, as well as genital warts. So the vaccine is recommended for both genders. It's considered gender neutral.
And what vaccines are available?
We have Gardasil, which comes in a quadrivalent 4 strain and a non-avalent 9 strain version. And importantly, India now has its own indigenous quadrivalent HPV vaccine, Cervavac, launched in 2022.
That's great news, an Indian vaccine. How does the schedule work?
It depends on the age you start. For younger individuals, typically ages 9 to 14, it's usually just 2 doses. For those starting at age 15 up to about 45, it's generally a 3-dose series. Above 45, it's more of a clinical decision based on individual risk discussed with a doctor.
And cost. Always a factor.
Yes. Gardasil is roughly 3,500 rupees per dose. Cervavac is currently priced around 2,000 rupees.
Still quite a bit for multiple doses.
It is. But there's significant hope and talk that the price for Cervavac might come down dramatically in the future, perhaps even to around 200 rupees per dose for government programs. That would be a game changer for access.
Wow, that would be huge. Okay, moving on. Tdap, tetanus, diphtheria, and pertussis. When should adults get this?
So a single dose of Tdap is routinely recommended for all adults, typically between 18 and 64 who haven't had one before, or if their status is unknown.
Just one dose.
One dose of Tdap. Then you need a booster for tetanus and diphtheria. That's the Tdap vaccine every 10 years throughout life.
Ah, the 10-year tetanus booster. Right.
Exactly. Now, if someone never got any childhood vaccines for these, there's a specific catch-up schedule. And crucially, pregnant women should get one dose of Tdap during each pregnancy.
Each pregnancy, why?
Yes, ideally between 27 and 36 weeks. This maximizes the transfer of antibodies to the baby, providing protection against pertussis whooping cough in those first few vulnerable months before the baby can get its own shots.
That makes sense. And it's used for wounds, too.
Yes, TIA or sometimes Tdap is given for tetanus prophylaxis depending on the type of wound and the person's vaccination history.
Okay. COVID-19, still relevant. What's the latest snapshot in India?
Well, as of our source data timeframe, which was around August 2022, Covishield and Covaxin had full market authorization. Others like Sputnik V, Corbavax, Covavax had emergency use authorization.
Right.
The basic schedule was generally 2 doses with different intervals depending on the vaccine, and then precaution doses or boosters were recommended.
Could you mix and match boosters?
Yes, there was the option for a heterologous booster. For example, Corbavax could be used as a booster after primary doses of Covishield or Covaxin, usually 6 months after the second dose.
Okay. And MMR, measles, mumps, rubella, is that just a childhood thing?
Not necessarily. Adults born after, say, 1957 who don't have proof of vaccination or immunity should consider it, especially important for certain groups.
Like who?
Adults who might be susceptible, maybe they only got 1 dose as a kid, or none.
Hmm.
Also, specific recommendations for HIV-positive individuals if their CD4 count is good, healthcare staff, international travelers.
How is it given?
It's a live attenuated vaccine, usually given as 2 doses, about 4 weeks apart, under the skin, subcutaneously. Critically, it's not given during pregnancy because it's a live vaccine.
Right, no live vaccines in pregnancy. Good reminder. So those are the main ones for generally healthy folks. What about the specific high-risk groups you mentioned earlier?
For those individuals, the list expands. Hepatitis B is a big one.
Who needs Hep B specifically?
People with chronic liver disease, definitely. HIV infection. Anyone at risk of exposure to blood or body fluids. So healthcare workers again, people who inject drugs, individuals with multiple sexual partners. Also, patients with chronic kidney disease, especially on dialysis, those needing frequent blood transfusions.
How's that given?
It's usually a 3-dose series using a recombinant DNA vaccine, generally very safe, including during pregnancy. Boosters aren't usually needed for most people, but might be for some high-risk groups like dialysis patients.
Do they check if it worked?
For immunocompromised individuals, yes, it's often recommended to check their anti-HBs antibody levels after the series to ensure they've responded. If not, they might repeat the course or need other measures.
Okay. What else for high-risk individuals?
Meningococcal vaccine is important for people without a functioning spleen or certain immune deficiencies, travelers to specific regions like the meningitis belt in Africa. Hepatitis A vaccine too.
Hep A, who's at risk for that?
People with chronic liver disease, again, because Hep A can be very serious for them. Travelers to endemic areas, lab workers handling the virus, close contacts of infected people, drug users, sex workers, people with HIV. Usually 2 doses. There's even a combined Hep A Hep B vaccine called Twinrix.
Lots of specifics there. Any others?
Yes, Haemophilus influenza type B Hib vaccine, not usually for healthy adults, but recommended for those with weakened immune systems, CSF leaks, after major head trauma, diabetes, pregnancy in some cases, cancer, people without a spleen, transplant recipients. The schedule varies.
Okay.
Then you have typhoid vaccine, mainly for travelers.
Yeah.
Varicella or chickenpox vaccine for adults who've never had it and lack immunity, especially healthcare workers or those around immunocompromised people. It's a live vaccine, 2 doses.
What about shingles? That seems common in older adults.
Yes, the herpes zoster or shingles vaccine. There's a newer recombinant vaccine which is highly effective.
Yeah.
Recommended for adults 50 and older and also for younger adults with certain high-risk conditions. It's 2 doses. Rabies vaccine is crucial for pre-exposure protection in high-risk groups. Vets, animal handlers, certain lab workers, maybe even travelers going to high-risk areas for extended periods, and of course essential for post-exposure treatment after a potential bite or scratch.
And cholera.
Collar vaccine isn't routine, but recommended for travelers going to areas with active transmission, or sometimes during outbreaks or humanitarian crises where water and sanitation are compromised. There are oral versions available.
Wow, it really is quite a tailored approach for adults, isn't it? Depending on age, health, job, travel.
Exactly. It's not one size fits all like the basic childhood schedule. It requires more individual assessment.
You mentioned travel vaccines specifically. Could you quickly list the key ones again? Some might be required.
Yes, depending on the destination, yellow fever vaccination can be mandatory. Proof might be needed to enter certain countries. Meningococcal vaccination might be required for travel, like the Hajj pilgrimage. And COVID-19 vaccination status is often checked.
Those are the mandatory ones, potentially. What about recommended ones?
Recommended vaccines really depend on where you're going, what you'll be doing, and your own health. But common ones to discuss with a travel clinic include typhoid, influenza, pneumococcal, hepatitis A, hepatitis B,
Okay.
maybe dengue in some areas, though vaccine availability and recommendations vary, and advice on malaria prevention, checking tuberculosis status, HIV, Zika risk depending on the region. Always best to get travel advice well in advance, maybe 4 or 6 weeks before a trip.
Good advice. So it's clear adult immunization is important, complex, and tailored. But you mentioned earlier, uptake in India seems low, despite awareness.
Yes, that API PCOS study you referenced highlighted this gap. It surveyed adults over 50 in 16 cities.
And found.
Found that while awareness was pretty high, 71% knew adult vaccines existed. The actual vaccination rate was quite low, only 16%.
Only 16% had received any adult vaccine. Wow.
Yes, and perhaps related, around 70% said they don't usually discuss adult vaccination with their doctors.
That's a huge disconnect. Why aren't people getting vaccinated or even talking about it? Any misconceptions found?
There were some common ones. About half seemed to believe vaccines could lead to dependency, which isn't biologically plausible.
Right.
And a similar number thought there were better ways to protect themselves than vaccination. This suggests maybe a lack of understanding of how effective vaccines are, or perhaps some distrust.
So what are the underlying challenges? You mentioned 3 Cs.
Right. We can frame them as complacency, convenience, and confidence.
Complacency meaning.
People might not perceive the diseases as a real threat to them as adults. It won't happen to me, or it's not that serious, or maybe they just don't think about vaccines beyond childhood.
Okay. And convenience.
That covers practical barriers.
Yeah.
Is it easy to find out which vaccines you need? Are they easily accessible, affordable? Is the information clear? Does the whole process seem appealing or like a hassle?
Access, cost, understanding. Makes sense. And confidence.
This is about trust. Trust in the safety and effectiveness of the vaccines themselves. Trust in the healthcare providers recommending and giving them. Trust in the system and the policymakers. Any weak link in that chain can lead to hesitancy.
Complacency, convenience, confidence. Okay. So how do we tackle these? How can we improve adult immunization rates?
Several strategies can help. Healthcare providers can use techniques like motivational interviewing, really engaging patients in a conversation about their health goals and how vaccines fit in, rather than just lecturing.
Better communication, basically.
Yes, improved communication is key. Using mass media effectively to raise awareness and address misconceptions, having clear, consistent government guidelines that are widely promoted.
And cost, making vaccines more affordable, like that potential HPV price drop.
Absolutely. Cost-effective vaccines and making them accessible through public health programs where possible are critical for equity.
It sounds like the family doctor, the GP, is really central to all this.
Immensely so. They're usually the main point of contact. They're ideally placed to assess vaccination status at routine checkups, maybe even during visits for other issues.
So make it a standard part of care.
Exactly. Assess, recommend based on individual needs, administer the vaccine if possible, or refer the patient, and very importantly, document it properly in the patient's record, integrating it into every clinical encounter.
Okay, before we finish, let's just quickly run through some of those common questions people have based on the source material. First, just to recap, why are adult vaccines important?
Because immunity can fade, our bodies change with age, they protect against serious diseases and complications, prevent spreading illness to others, and are vital for travel and certain jobs or health conditions. Simple as that.
And which ones are generally recommended again?
For most healthy adults, annual flu shot, Tdap, 1 dose, then TB boosters, pneumococcal, especially older adults, HPV, possibly MMR if needed, and COVID-19, then others based on risk.
How often are they needed? Varies a lot, right?
Yes, very varied. Flu is annual, TD booster is every 10 years, HPV is a series, Pneumococcal might be once or twice in adulthood. Shingles is 2 doses. It really depends on the specific vaccine.
Are they safe for adults?
Yes, adult vaccines are generally very safe. Rigorous testing happens before approval, and safety is constantly monitored. Minor side effects like a sore arm or mild fever can occur, but serious reactions are rare. Benefits almost always outweigh risks.
Can people with medical conditions get vaccinated?
Usually, yes. In fact, it's often more important for them as they might be at higher risk from the actual disease, but it's crucial they discuss their specific condition with their doctor to tailor the vaccine plan. Some vaccines, like live ones, might be contraindicated in severely immunocompromised people.
What about pregnancy? We touched on Tdap and flu.
Yes, Tdap and the inactivated flu vaccine are recommended during pregnancy. They protect both mother and baby. Live vaccines like MMR and varicella are generally avoided during pregnancy. Always consult a doctor.
And finally, travel vaccines.
Key takeaway: plan ahead. Consult a travel health expert 4 to 6 weeks before your trip. Requirements vary by destination. Yellow fever, meningococcal, COVID-19, sometimes mandatory. Recommended ones depend on the region and activities. Hep A, typhoid, etc. So wrapping up this deep dive, the key things are, I think, vaccine-preventable diseases are still a significant issue for adults. Adult vaccination works, it saves lives, it prevents suffering.
But it's underused.
It's definitely underutilized in India,
Yeah.
despite vaccines being available. There's a real need to standardize the practice, make talking about and offering adult vaccines a routine part of healthcare.
Absolutely. And maybe a final thought for everyone listening. Given that our population is aging and so many of these adult diseases are preventable, how can you personally be more proactive? Maybe think about your own vaccination status. When was your last tetanus shot? Have you had a flu shot this year? Are you eligible for others based on your age or health?
It's about taking that step.
Exactly. Take that step. Have that conversation with your doctor about what's right for you. It's about protecting yourself and contributing to a healthier community. Thanks for joining us for this deep dive.